Clinical case vignette: sciatic nerve compression piriformis syndrome. A 36-year-old female yoga instructor presents with buttock pain that radiates down the posterior thigh. The pain started gradually over several weeks and worsens after prolonged sitting or deep stretching. She denies trauma, but mentions that she frequently performs deep hip stretches and long hours of sitting while driving. On physical examination, tenderness over the piriformis muscle, deep gluteal region, pain reproduced with passive internal rotation and adduction of the hip, piriformis test positive, straight leg raise test negative, intact reflexes and sensation in the lower extremities. MRI of the lumbar spine is unremarkable, ruling out a herniated disc. Question 1. Which of the following is the most likely cause of this patient's symptoms? A. Lumbar disc herniation. B. Piriformis muscle compression of the sciatic nerve. C. Sacroiliac joint dysfunction. D. Trochanteric bursitis. Answer. Rationale. Piriformis syndrome occurs when the sciatic nerve is compressed by the piriformis muscle in the deep gluteal region, causing buttock pain radiating down the thigh. Unlike lumbar disc herniation A, piriformis syndrome does not present with neurological deficits or a positive straight leg raise test. Question 2. Which of the following physical exam maneuvers is most useful in diagnosing piriformis syndrome? A. Straight leg raise test. B. Tinel's sign. C. Piriformis test. D. Patrick's Fet test. C. Rationale. The piriformis test involves passive internal rotation and adduction of the hip, which stretches the piriformis and reproduces pain. Straight leg raise, A, is positive in lumbar disc herniation, Tinel's sign, B, is for carpal tunnel syndrome, and Patrick's test, D, assesses sacroiliac joint dysfunction. Question 3. Which of the following is the most appropriate first-line treatment for piriformis syndrome? A, surgical decompression, B, lumbar laminectomy, C, physical therapy and stretching, D, high-dose corticosteroid injections. Answer. Rationale. Physical therapy focusing on piriformis stretching and strengthening is the first-line treatment. Surgery A and lumbar laminectomy B are not needed, as this is a soft tissue issue rather than a spinal pathology. Corticosteroid injections D are only used in severe cases. Question 4. Which anatomical variation increases the risk of developing piriformis syndrome? A. Sciatic nerve passing through the piriformis muscle. B. Abnormal branching of the femoral nerve. C. Increased Q angle of the knee. D. Presence of an accessory obturator nerve.
Answer.
Rationale. In some individuals, the sciatic nerve passes through the piriformis muscle, predisposing them to compression and irritation. This anatomical variation increases the likelihood of piriformis syndrome. Would you like any